Hi everyone, my name is Nelson Lee and I'm going to be giving you this little refresher from the training that we did. This little refresher training is teaching you how to operate the tablets for doing direct observation on the UCLA NHF nurse workflow project. Okay, so if you remember correctly, one of the procedures that you're going to follow is you're going to do 2 hours of direct observation on a nurse. And for doing that direct observation, you're going to use the PDA tablets here. And you'll use this tablet to basically follow the nurse and collect the information about where they spend their time and how they spend their time. And I'm going to walk you through the tool right now so that you can basically see exactly what information you're collecting. Okay, notice when you take the tablet, the Samsung tablet, and turn it on, you'll have a blank screen. When you turn on the PDA device or the tablet device, you'll have a screen that looks like this. This is your welcome screen. I want you to go ahead and swipe to unlock. Okay, so when you swipe to unlock, you'll see a setup screen that looks like this. All right. The software that you want to open in this tool is UMT Plus. I want you to touch with your fingertip the UMT Plus icon. When you do, the UMT Plus software will open, and it will open up directly into the data collection software. A couple things I want to point out about this interface. Notice along the bottom you have a menu. This menu is what you'll use to start and stop the study. It'll also be used to make a correction if you've made a mistake on a data entry. And it'll also allow you to jump from an activity screen back to a location screen for when the nurse changes locations. Okay, so that's the purpose of these icons down here, the first 4 icons here at the bottom. All right, so to start a study, what you'll do is you'll meet with the nurse, basically inform the nurse what you're doing. And then when you're ready to start the study or the observation, you'll hit this green button. Once you hit the green button, the tablet will take you into a series of questions. Those questions are basically demographic information that you'll collect from the nurse. So for example, the first question is, what's the hospital name? I'm just going to basically enter some basic default information, but you'll have to type this into your keyboard as you ask the question. The next question is, what's the unit name? So you'll just enter the unit that you're on. Then the participant ID. This will be provided to you by the study team. So here you'll enter a various participant ID number, and then hit the next button. The next question is, what's the observer's name? In this case, I'm going to put my name. You'll actually enter your name here, and then hit the next button. The next question is, how many RNs on this unit at the beginning of the shift? I'm going to go ahead and just put 12. You'll need to know this before you start your data collection. How many LVNs? I'm just going to go ahead and put in some basic number information here. The number of CNA UAPs, okay. Okay, now this is the unit census at the beginning of the shift. I'm going to go ahead and just put in some default information. Actually, it's at the beginning of your study. Number of patients assigned to RN at the start of your data collection. So if it's a 5-to-1 staffing ratio, let's just assume that it's 5. And at this point, we've entered the basic study information at the start of the study. The next thing we do is we have some more survey questions we need to answer. And so we're going to do that by hitting the Start Survey key here. And it's going to take us through some other additional questions. So the participant's age is the age of the nurse that we're observing. So in this case, I'll say that this nurse is 40 years old. What's their gender? Male or female? Employment status. Okay, their highest education level. We'll say it's a bachelor's degree. Race, ethnicity. Okay, you can put this information in here. And obviously you have that option there. The years worked as an RN. Okay, so you're going to ask the observer this question. I'm going to say that this nurse worked 18 years as an RN. Years worked at the hospital. I'll say they worked here for 18 years. Years worked in acute care. I'll say 12. Years worked on this unit. I'm going to say 4. Okay, now you're going to ask the nurse whether they're satisfied with the quality of care. And their options are strongly satisfied, satisfied, neutral, dissatisfied, or strongly dissatisfied. Okay, the next question is, are you satisfied with your workload in the past 90 days? Okay. The next question is, describe your workload. Are you overwhelmed? Was the workload about right? Or are you underutilized? Okay, the next question is job satisfaction in the past 90 days. How satisfied are you with your job?